Here are 3 ways that you can regain knee extension after ACL surgery. The first one is you're going to take a foam roller or a towel roll and place it underneath your heel while laying on your back. So as you can see here, I took the foam roller, or you can roll up a towel roll and place it underneath your heel. And all you're doing here is just letting your leg sink. This is super important because we want to make sure that we gain passive knee extension first right after surgery. This is super critical. The first few weeks you want to be able to regain your full knee extension. One thing you can do while you're here is you can start squeezing your leg as well, trying to drive the back of your knee down into the table. Now we are coupling our passive with our active knee extension. With this, I usually will prescribe this for 60 minutes total a day. You can break this up based off of your tolerance with a minimum of 3 minutes of a hold. So starting off, you might be able to only tolerate 3 to 5 minutes of your leg being in this position due to pain and discomfort. But I want to make sure that we can start to accumulate more time over the course of time as the pain goes down. So shooting for about 5 by 10 minutes or 4 by 15 minutes right after surgery. The second exercise that I will prescribe for all my patients after surgery is doing a passive knee extension with an assisted strap. So using a strap or a towel or a sheet, we can place this on the bottom of our foot here. And now I'm going to take my one hand, I'm going to place it above my knee. And what I'm going to do is I always give the cue, pull, push, squeeze. So I'm pulling up on the strap, I'm pushing down above my kneecap here, and I'm squeezing my muscle. And as you can see, my heel is starting to prop up off of the table, meaning that I'm truly getting good passive extension. By coupling the squeeze with it, I am getting active extension. And one way I will start with is just by having somebody use the strap to their assistance so that we're working into this position. And then as they start getting stronger and having more control of this position, I will have them let go of the strap and try to maintain the height of their heel. And so what I will prescribe for this one is over 1,000 repetitions a day in those first 2 weeks, really working on gaining not only passive, but active extension as well. The third thing I will do to work on extension is more active. So as we have gone through those first 2, this is the third one that I will add into the mix as well, called the heel pop. So I will have the individual laying down, whether it's on their bed or on a table, and having their heels completely off of the table. And this is important because a lot of people, when they start doing quad sets, they'll drive their heel into the back of the table, making them use their hamstrings to recruit, and they're doing more of a hip extension to their hamstring opposed to using their quad muscle to get the active extension. So by taking the heels off the table, it takes away their chances of using their hamstrings to engage knee extension. So how I will do this is I will have them either I'll roll up a towel underneath behind their knee early on just to give them some feedback to push down into it, or as they're getting better and they're able to get more of that recruitment, I will have them just crush the table. So drive your knee down into the table while you're trying to pop your heel up. And this motion should already be familiar because we've already done the strap assistance. So again, this is one that I will prescribe over 1,000 reps a day in those first 2 weeks to regain active knee extension. The heel pop is super critical because it tells me that we're not only getting our extension, but we're getting our active hyperextension equal to the other side. So those are 3 exercises that I prescribe to every single one of my patients after ACL surgery. So I hope that this helped, especially if you're having difficulty regaining your extension. Give those 3 a try and let me know what you think. Thanks for watching.